Hello, my name is Stacy and I'm going to be demonstrating how to perform an IV push medication on a pediatric client. So first I'm going to go ahead and list off 4 common sites that IVs are typically used on pediatric clients. So you have your femoral, your basilic, your cephalic, and your frontal. And then next I'm going to go ahead and do my general principles and safety practices, my 3 medication checks, and my 11 rights to medication. I'm going to identify my patient using 2 identifiers. I'm going to assess for any allergies. I will check that with the MAR and with the patient to see if there's anything new. I would then perform hand hygiene and place my gloves. I would come over to the patient, make sure that the IV is unclamped. I would take an alcohol swab and scrub vigorously at the port. I would then take my flush. I would aspirate for blood return, and then I would flush over 1 minute or according to the facility's policy. At this time, I would be checking for any infiltration, any inflammation, or any signs at all that the IV has gone bad. So everything looks perfect. I will now take the syringe with the medication, before I do that, I will clean my port vigorously with a clean alcohol swab. I would then take my medication. I would administer it over the prescribed rate. I would then take a new alcohol pad and clean vigorously again at the port. Take my new flush. Flush the medication again over 1 minute or at the facility's policy. Perfect. I would then clean the port vigorously again, and I would apply a Curos cap, a disinfection cap. I would clamp the IV. I would come back in about 15-20 minutes and I would reassess the patient to see how the medication's working. Are there any side effects or anything like that? I would document and record my findings.